Happy Wednesday and welcome to Back Talks with Dr. Sean McWilliams. Always great to have you here. Want to welcome you if you are our first time to our community. Welcome. It's so great to have you here. And if you're one of our many followers who follow us every single week, welcome back. We are a community of people that support each other when it comes to back pain and managing it without surgery and without drugs. And that's why we come here every single week to give you a state of confidence and hope, inspiration, knowledge, so that you feel that you can make the best informed decisions when it comes to your spinal pain and managing it without going under the knife and without taking dangerous and addictive drugs. So great to have you here. So what are we going to be talking about today? Well, if you've been with me for a while, or if you've noticed, we have just launched the premiere of the course that we have been creating for over a year and a half called Disc University. So what I'd like to do is I'd like to kind of show you a little bit about maybe why Disc University might be the answer for you if you are suffering with chronic or debilitating neck pain or back pain, especially if you're a mom who, you have a child or a couple of children, and just life isn't how it used to be, and you can't be the mom that you used to be. So if that's the case, stay with me, because I created something just for you to change your life, possibly forever. If you are on with us, say hi. Hi, Stephanie. Great to have you here. Hi, Marisa. Great to have you here. Good afternoon to both of you. So I'm going to show you our latest update to a course. But before I want to do that, I want to kind of tell you a little bit of the backstory behind it. So 2 years ago, I was asked to be a keynote speaker in a very large conference in Louisville, Kentucky. And I was teaching on how to heal and correct bulging and herniated spinal discs without surgery. And yes, that can be done. And so about halfway through my presentation, to 3/4 of the way through my presentation, I was started to show pre and post MRIs of patients of mine after a 12-week period of going through the process that's proprietary to me, that I've created, and I wanted to show them the difference. So we put up their pre-MRI and their post-MRI, and people's eyes just lit up, and hands started going up like, you can do that? And the answer is yes. In probably 80% of cases, yes, you can do it quite well. Believe it or not. Unfortunately, your doctors don't really tell you a lot about that, so that's why you have me here to tell you about it. And so after that, I got bombarded by a lot of people for the next day and a half saying, Dr. McWilliams, can I please come talk to you? Can I show you my MRI? This is what happened to me. Do you think that, doing spinal decompression would help me like the people that you showed? And I was just like, yes, I think you have everything to gain by doing it. And so I said, listen, give me a few weeks. I'll do some research. I'll help you find someone in your community, and we'll get you all set up. And you just saw this look of hope again in their eyes, and you could feel the energy from their heart of just being like, oh my God, there is a chance that I can do this. It was so exciting, and I loved doing it. And so I get home, I start doing all this work, and unfortunately, after about 3 weeks, I found 2 people out of about 30 of them that had a practitioner in their city or town that was knowledgeable and had the equipment to do it. And I had to tell the rest of them that there was nobody in their community where they lived. And I got to tell you, it really crushed my heart. I was so excited and so inspired to be able to help these people change their lives without having to get cut open again, without having to sell their farm again, have to move back in with their mom and dad again when they have a family and children because they are in so much back pain and they can't work anymore. Yeah, that's a real story. It was one of the girls that I met there. And in fact, she was one of my biggest inspirations to create Disc University. And she was one of the ones that I had to call and tell her there was nobody in her community at all for at least 4 hours. And that broke my heart. So I started thinking about creating a course for doctors so that we could create a greater network of doctors that are trained in how to do spinal decompression, also had the equipment to do it, did it at a very high scientific level, and could bring these type of services to these communities that don't have it. And then you know, sometimes God just puts his hand on you and gives you a slightly different vision or a new vision. And then I started thinking, I was like, well, wait a minute. I said, okay, yes, I could teach doctors, but what if there's not doctors in the community where you live? What if you're out in the farmland somewhere in the middle of Minnesota or in the middle of Texas or in the desert in Arizona, and you can't drive, or if it's a 3-hour drive or a 4-hour drive or maybe longer, like that's not really feasible. So I started going, I wonder if I could digitally clone myself. And that's how Disc University came to be. So I've spent the last year and a half figuring out how do I create video modules and also offer live support for people that need that live support, where I can take you week by week, day by day, show you exactly what to do, show you what not to do, and support you in getting you to feel good again in 12 weeks without surgery and without drugs, with an 80+% success rate. And so that's what we did, and that's how we created Disc University. So I'd love to share that with you, being that we have our official launch this week. So let me show you a couple things that you get to learn in Disc University and the benefits that you're going to gain by understanding this knowledge. So let's take a look here. So at first you're going to see, you know, if you purchase and you choose that you think Disc University is a good fit for you, if you purchase this, you'll get to see a little bit of a bio of me. You'll see that there's 26 video modules, so I've recreated myself on video to take you through every single thing I would take you through if you came to my office, but you get to do it from your home. So let me show you a little bit more up close. So the first thing that you get to do is I get to track your progress for you. So I know exactly where you're at in your progress. So this person right here, you can see they've completed 3 sessions. So they've done about 10%. So I know how they're doing, if they're on track, they're getting behind, because I want you to be successful. I want you to feel great again. And we all need some encouragement, right? So the first thing you do is obviously want to thank you for being part of our family, and thank you for the investment in yourself, and thank you for a purchase from us. And I want you to know that every time that you buy Disc University, if you go into our website, onto the giving back part of our website, you're going to see one of my favorite organizations that my girlfriend and I, Marisa, is Kiva. And I want you to know we take 5% of everybody's investment in Disc University, and we give microloans to people all around the world. And if you could see to the right of me here, I have a huge map. It's probably 8.5, 10 foot tall. It's probably at least 10 foot tall and 15 foot long of the world. And it's our goal to help people all around the world be able to invest in themselves, to better their family, to create businesses. And some of these people need a loan for $250, $300, $400. And I just want you to know that every purchase that you make, we take 5% of what you bring, and we help give microloans to these people around the world. And if you can see, we got pins all over them with their names on there. And I want you to know that not only are you giving to yourself, but you're also giving to people around the world and making their lives better too. So it's a win-win. So sometime go check out kiva.com. It's pretty cool. So just wanted to let you know that we love doing that. We love making this world a place with less spinal pain, if not no spinal pain, and also making other people's lives as happy and healthy as well. So after we thank you for that, we show you some success stories to inspire you. I show you pre and post MRIs of other patients, and as I want you to know, you can be successful as well, and in 80% of the cases you can have very high success rate. Next thing we do is I go over guidelines for healing. Why do you need to know this? Well, you need to know what should you be doing and what should you not be doing when you're going through a program like this of therapy. So I don't want you guessing at anything. So I took the last 25 years of people, we looked at everything that made them successful, we saw the things that made them go backwards or get stagnated in their progress, and I created a video and a written sheet for you so you don't have to guess what to do, just to watch the video. And if you have a significant other, please watch it with them so that they can support you and understand maybe why you're not vacuuming at this point, maybe why you're not going out for a walk right now, or you're going to the gym anymore, or whatever, you can't lift right now. And I explain everything of when you can do stuff and when you can't, and how to do things so that we can maximize you feeling better the fastest. All right, so we got that for you. Then we wanted to get you right into doing your therapy. So the very first one here, you can see my son Dylan, we teach you how to do home-based spinal decompression. And so If you're getting the course for the low back, it obviously is going to have the video module for using the low back unit. And then if you have, if your neck is your focus, then there's a video to show you exactly how to use the neck module as well. I want you to know, also included in your investment in yourself in your course, we send you the home-based therapy unit and you keep it. It's yours to keep, all right? And we'll show you what to do after you go through this 12-week module. So we want to get you start doing your therapy right away so you start feeling better. Then I want you to know, how are you going to feel after your first session of your therapy? You need to know that so you know you're right on track. So we have a video for that. Now, you got to track your success. It's super important. So I teach you how to track your success as you go through this therapy program over 12 weeks. We give you a sheet, a PDF sheet. We have a video that is explaining exactly how to use that sheet, because remember, if you can measure it, you can manage it. And I want to know if you're doing great. I want to be able to look at your sheet for you and know why you're doing great. Why is it being successful for you? And if you're struggling a little bit or you're not getting the exact pain relief that you're looking for in a certain period of time, I can look at how you're tracking it and tell you, hey, you're right on track with this, you're right on course, or let's make this adjustment, okay? So tracking your success is super important for nutrition, for hydration, for stretching, for icing, for doing your decompression. So we want to measure all of those things every single time you do it. Now, there's going to be times that you're going to feel like you just need some heat or ice. When do you use which one? Do you know that most of the people I know do the opposite of what you're supposed to do? So I don't want you guessing. I created a video just for you. So if you or someone in your household injures themselves, you'll know exactly what to do. Do you put heat on it or ice on it? So the video will clear totally up for you. I also want to teach you how to get out of bed. I know it seems like a simple thing, but I'm telling you, they're little baby steps. So, you know, it's like playing baseball. You go from home plate to first base, and then first base to second base. You know, and if you don't step on the bag, you're out. So we want to make sure that you know all the little things that add up to your success, and one of them is getting in and out of bed properly. So I teach you how to do that. The other thing we're going to start moving into is optimal hydration. So optimal hydration. How do you know how much water you should be drinking? Your disc is almost 80% water. It needs it. What kind of water should you be drinking? How much should you be drinking a day? How often? So we created a whole video of me teaching you exactly how to do that as well. Now, we want to feed your discs. Your discs need nutritional parts to repair themselves, building blocks to repair themselves. And I go over every single thing that you need to do so that you don't have to guess at anything, so that you can start to get your disc to heal from the inside out and the rest of your joints in your body as well, so it has maximum benefit. It's not just for your spine. I'm going to teach you a little bit about intradiscal pressure. It's really important to understand intradiscal pressure. That's the amount of pressure inside of our discs. And why do you need to know that? Because I want you to help avoid things that are going to increase that pressure and slow your healing. I want you to feel better the fastest, and to do that, you got to understand the intradiscal pressure. So you watch that video and you'll understand all about it. And your doctors are not going to tell you this stuff. I'm just going to let you know that. And even if it's your low back, I'm going to teach you how to stretch your neck, because I want your neck to stay healthy for you and I want you feeling good. We're also going to teach you my best stretches over 25 years of being in practice. The best stretches for your low back that's going to help you relieve your pain and reduce your pain as quickly as possible. I want to talk about inversion tables, because people ask me about that all the time. So I'm going to teach you the pros and the cons of inversion tables. We're going to talk about failed back surgery syndrome. It is a real thing. So if you're considering surgery, I want you to watch that video as well, because it's a ICD-10 code right now, failed back surgery syndrome, and it happens a lot. And if you don't believe me, look at Tiger Woods. He's got 5 of them right now that he's failed. Guy's a wreck, you know, which is a shame. Because he went a surgical route. So I want you to understand about that. It's really important. Now, as we get into around week 6, if you're making the progress we expect, we're going to start core strengthening with you. We're going to start you at level 1 core strengthening exercises to start to give you some stability. Every week I have a video to teach you how you should feel after that week of care and treatment, so that you're not guessing of where you should be. All right? So you can see those. Watch this video after your 8th week of spinal decompression or therapy. Okay? At around 8 weeks, we're going to start to teach you core level 2 exercises if I feel you're ready for it. Around 10 weeks, we're going to give you level 3 as well. And as you can see, we're going to put in here, so you know, after your 12th week, how should you be feeling? And so, and then at the end of that, just because I messed up a ton over a year of videoing these courses, I share my disc bloopers with you. So you'll get to see all the mess ups. Well, not all of them, because there was a lot of them, but you'll get to see quite a few of them. And I hope that it just brings some laughter to your life. If you've ever shot professional videos, you know that we mess up a lot. You just don't always get to see it. But I wanted to share some of the funnier ones that made me laugh, at least. And I hope they make you laugh as well. So it's a pleasure having you here. I hope that if you're suffering with back pain or neck pain, you will go take a look at Disc University. I'm going to put a link here. I'll show you in a second. I'll show you a link. If you don't know which direction to go, if you're looking for a non-surgical approach to your spinal pain, if you're tired of getting injections and epidurals, if some doctor's telling you that the only way you're going to be able to manage this or you're going to get surgery or be paralyzed, if you're dealing with things like that, if you just can't be the mom or the parent or the grandparent or the worker that you want, or just the human being that you used to be, and you don't feel that way anymore, please use this link right here. You can go to booking.drshawnmcwilliams.com, and right now I'm giving complimentary consultations away for a small group of people. I want you to know, if you came to my office, this was a $197 charge. And right now I'm doing it complimentary. I only take 3 to 4 people per day on average, just because I want to give you my full best attention to help guide you. And if Disc University is the right fit for you, I want to let you know that, and I want you to buy it because I want you to stop suffering and start feeling better. And if for some reason I don't think it's the right fit for you, I'm going to let you know that, and I'm going to help you find the right people to help you as well. Okay? So no matter what, it's going to be a win-win. So please go take a look at that. You can get on my calendar, and slots are limited. I don't do a lot of them right now because normally I charge for them. But if you are suffering with this, or someone in your home, or someone that you love, or at church, or your coworker is suffering with debilitating back pain, and they're not getting better, and they're only going in the medical route, have them go take a look at that site. They can book an appointment with me. They can fill out a form and let me know everything that's going on with their back. And we'll set up a Zoom call and we'll chat. And let's see if we can get you some help or get them some help. So I love and appreciate you. Thank you guys so much. Stephanie, Marisa, thank you guys so much for always being here supporting us. If you're new, welcome. If you're one of our regulars, welcome back. It's great to have you here. If you have questions for me, send me a DM as well. And if you want to talk to me in person live and help you navigate your issue, make sure you go to booking.drshawnmcwilliams.com. All right, guys, have an amazing day. See you next week.